It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following. My dog coughs like he has something choked. If you've ever noticed your dog coughing persistently, as if he had something lodged in his throat, it's natural to worry. By understanding the possible reasons for your dog's cough, you can take the appropriate steps and seek the necessary veterinary attention. We will talk about various factors that can contribute to this particular symptom. 1. Partial obstruction of the airways. One of the main causes of coughing in dogs is partial obstruction of their airways, often due to their inquisitive nature and tendency to explore the world through their mouths. It is not uncommon for dogs to find objects to chew on, such as toys, sticks, or even food, which can lead to choking and foreign bodies entering their airways. If you notice that your dog's cough is productive, that is, that he is able to expel the foreign object on his own, you can keep a close eye on the situation. However, if the cough persists and the foreign body remains lodged, it is essential to seek immediate veterinary attention. It is important not to attempt to remove the object yourself, as this can cause further complications or injury. 2. Infectious tracheitis. Tracheitis, which is inflammation of the windpipe, is a common condition in dogs. One of the most recognizable signs of tracheitis is a dry cough that usually comes in episodes and can end with retching or even vomiting. This distinctive pattern of coughing often worries dog owners as it looks like their pet has something stuck in their throat. However, the reality is that there is no obstruction in the airways, rather, the cough is the result of inflammation of the trachea itself. In the case of infectious tracheitis, a specific antibiotic treatment will be necessary. To determine the appropriate antibiotic, tracheal lavage can be performed to obtain a sample that can identify the causative agent. Based on the results, the vet can select an effective antibiotic for treatment. Remember, early intervention is key to managing tracheitis and ensuring your dog's well-being. 3. Non-infectious tracheitis. In addition to infectious tracheitis caused by pathogens, there are other forms of tracheitis that result from non-infectious processes and cause inflammation of the trachea. These causes include alterations of the oropharynx, congestive heart failure, constant barking, leash pulls. In these cases, the main goal is to control the underlying cause of tracheal inflammation. Therapeutic interventions for non-infectious tracheitis usually involve the use of cough suppressants, such as codeine or butorphanol, to suppress coughing and provide relief. Anti-inflammatory medications, such as corticosteroids, may also be prescribed to reduce tracheal inflammation and relieve symptoms. If your dog is displaying symptoms consistent with tracheitis, it is essential that you seek veterinary attention. A thorough examination and diagnostic tests will help determine the underlying cause and guide appropriate treatment. 4. Tracheal collapse. If you're wondering why your dog is coughing like he has something in his throat, tracheal collapse is another possible cause to consider. Tracheal collapse refers to the progressive and irreversible degeneration of the trachea, specifically of the dorsal membrane and tracheal rings. Dogs affected by tracheal collapse, often small breeds, middle to older in age, and overweight, often present with a distinctive hacking, dry cough that resembles the croaking of a goose. This pattern makes it appear that your pet has something stuck in its throat. Additionally, affected dogs may experience wheezing or wheezing, along with other symptoms such as shortness of breath and exercise intolerance. 5. Laryngeal paralysis. If you notice your dog coughing frequently while he eats, laryngeal paralysis could be the cause. Laryngeal paralysis is a condition that affects the upper respiratory tract, where the laryngeal cartilages do not open properly during inspiration. It can have a congenital or acquired origin and can be unilateral or bilateral, depending on the degree of laryngeal involvement. Dogs with laryngeal paralysis present with abnormal breath sounds, respiratory distress, exercise intolerance, and difficulty vocalizing or barking. Paralysis of the laryngeal cartilages also affects their ability to close properly during swallowing, which can lead to choking episodes when drinking water or eating food. In response, coughing fits may occur as the dog attempts to expel food that has entered the respiratory tract. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.